be here. Thank you for the opportunity. Chuck Applin's an athletic trainer. He's our COO. He's also a certified ergonomic analysis specialist and works with our testing department where we test people and see if they're actually capable of doing the physical command. So he'll jump in here when he sees fit. So I know there's things that you'll see and say, oh, you know what? So please jump in because he's got a lot of valuable things to add. I've been giving this talk in one form or another for a long time, and what I try to do is I try to adapt it to the individuals that I'm speaking to, but the first thing I always say, particularly when I'm speaking to a group of highly skilled individuals, is that I'm not the expert in your job, okay? I don't want to pretend to be the expert in your job. My job is to familiarize yourself, to familiarize you guys with what we know to be sustainable habits in terms of taking care, first and foremost, of your spine, okay? And then secondarily, your body will follow, okay? So your spine, most of you guys know, has to protect your nervous system, has to carry you around your whole life, all the limbs attached to it, you know, the hip bone's connected to the... So it's all true. It's all pretty much connected and wired through the spine. So when we take care of the spine, everything else generally falls pretty good. So we're not going to just talk about how to move better and be more efficient in terms of your movement patterns, but we're also going to talk about how to take care of your spine. Because one of the things that's unrealistic is for us to expect you guys to have perfect body mechanics every single day with every interaction, particularly when you're working with animals. And my hat's off to you guys. I don't know how you guys do it. I deal with human beings and I struggle, you know, like get them to do things. So my hat's off to you guys. That's got to be quite a challenge. How do you ask a history of the dog? I guess you ask the dog. So tell me. So that's always been impressive to me. Before I get started, I'm going to show you guys just a quick 1-minute video of our clinic so you guys can just kind of see about us, and then I'll get into it. And here you go.
When you go that vibe, it makes you want to get better. I've been counting there for years. Physical therapy, chiropractic care, training. Just don't stop shopping. And there's everything. It's quality care. People will get something up.
Dr. Jimenez, you have a patient room 7, Dr. Jimenez, room 7.
Yeah, monitoring you, getting you back on your feet the way you're supposed to be. It's a very warm staff and very knowledgeable. They make it easy so I can see exactly why they're voted the best.
When you're ready to make a commitment to your health, you're ready to work hard, Omega Rehab Sport is the place for you. At the end of the day, we want what's best for the patient. We designed the facility much like an athletic training room, so just like in professional athletics, the professional athlete gets direct access to what they need immediately. Here at Omega Rehab Sport, you can expect to get the right clinician for the right condition.
Omega Rehab Sport is all about an active care philosophy. We have an entire staff that lives the active lifestyle. That's what we want to project to our patients. We want to teach you how to have fun when you're doing recovery. People come in, we laugh, we have a good time, we give them things that are fun to do. It's not just coming in and laying down at the table. That's not fun to people. People often say, well, kind of a recess for adults. That's what they're for, is to have a good time, get better, and be empowered to make a difference.
There you go. Okay. That's our little 2-minute video about us. Okay, so let's jump into it. So why are we all here? Well, we all want a healthy spine. Okay. And these are both of our companies. The other one I'll talk about is a product that I created to help you. Some quick facts. I don't want to spend too much on this. Basically, what you need to know is that back injuries are on the rise, and there's lots of causes for it. Okay. My job is to educate you guys so you guys can reduce the probability of that. But one of the things I put on here at the very bottom, you'll notice that it says multifactorial, and we know that from a number of studies. There's multiple factors that affect the health of our spine. So just to make it really overwhelming, these are all the things that can affect the health of your spine. Okay, some things you can change, some things you can't. The things you can change I put in green. Okay, what we're going to talk about today is really more of the mechanical aspects of how to take care of your spine. What do I mean by mechanical aspects? Okay, so let's make it really simple. Postural awareness. Okay, who doesn't know that good posture is good for you and bad posture is bad for you? You guys all know that, right? So what does it mean when we say putting posture into motion? What do we call that? You guys know? It's called body mechanics. okay, or movement habits. Okay, so that's all I want you guys to really think about is habits. When you do something one way repeatedly, you'll tend to continue to do it in that same way until something breaks. Okay, and there's better habits and there's worse habits. So I'm going to introduce you to those things, and that's what we call movement patterns or movement habits. Rest and recovery. So one of the things I'm really, really big on is taking micro breaks throughout the day. So these are like simple 30-second breaks, 30-second stretches that you can do to help your body recover. Okay, and if you do more of those throughout the day, the probability of the cumulative effect is much lower. Okay, so when I say cumulative effect, it doesn't matter what your job is. It doesn't matter if you're a veterinary technician. It doesn't matter if you're a baseball player or a chiropractor like me. You know, there's a repetitive strain effect on even what I do. So when I take micro breaks and take the concept of recovery and apply it as a habit, then you're more likely to have longevity out of your body. Okay, so think of it like, well, it's not a great example, but changing the oil in your car. You know, if you don't do it, it's eventually going to make the engine wear down. Spinal mobility and flexibility. So spinal mobility, the primary spinal immobility is in the mid-back. And somebody tell me, why do you think that is? Anyone want to venture a guess? Think about what we do all day. Where is every interaction? Is it in front of us or behind us? It's in front of us, right? So as a result, what happens? We bend forward. So when we bend forward, what happens is the mid-back gets stuck in that position. So if you simply start by doing nothing else but regaining the extension in your mid-back, then you're going to have more room for upright posture. Okay? So most people that come in that have a neck and back problem, I don't adjust their neck and I don't adjust their back, I adjust their mid-back. Because 9 out of 10 people that come in with back problems, guess what they have? They have at least 5 to 10 degrees of forward head fixation, we call it. They're stuck in that position. Okay? So if you can take the concept of gaining mobility, particularly in the mid-back, it'll be easier for you to stay upright throughout the day. Okay? Because what we don't know is as our center of gravity shifts forward over our lifetime, it increases the wear and tear, or accelerates the wear and tear on all the connective structures in our neck and low back. Okay? Think about if you just take a bowling ball and you hold it like this all day, what's going to happen? It's going to strain the muscles, right? The spine's a little more complex than that. There's joints, there's nerves, there's discs, and those discs we're going to talk about intimately. And the last thing is stability. And stability comes from a combination of alignment and core strength. Okay, so we'll talk about how you can simply improve your core strength. And I already talked to you guys about alignment too, really. When you gain mobility in your mid-back, the primary misalignment corrects itself. Okay, so most people can improve their own alignment by simply improving their mid-back extension, their ability to bend upright. Okay, here's our goal today. I want you guys to understand the 3 postural habits, and I want you to understand disc pressure, because 90%, and this is a guess, but I bet it's more than that, really don't understand what disc pressure is. Okay, so we're gonna, who knows what the discs are? You guys have animals, so you guys know they have discs, right? Just kidding, I know they do. So those discs are under a different kind of pressure in human beings, where most animals are quadrupeds, so their weight distribution is different. As upright beings, we have to interact with everything in our environment forward, so as a result, that increases the disc pressure, somebody guessing, 2 areas where 99% of all the surgeries happen on the spine.
The TL junction?
It's actually at the lumbosacral junction, but that's a good guess. What you did point to is the junction. And that's the 3rd spot that tends to get problematic. The first spot is the bottom of the low back, the junction between the lumbar and the sacrum, okay, because that's where we hinge, okay? So the more you bend there, you just wear that tissue out, okay? The other spot is the junction between the neck and the mid-back, so the cervico-thoracic junction, that's where we hinge. Okay, so if you simply become aware of that and just apply a little more awareness of your posture in the course of movement, you're going to significantly reduce the probability of things occurring. Disc pressure is important because I want you guys to understand how disc pressure increases, because disc pressure doesn't necessarily mean pain, but it means micro tears. It causes small breakdown over a long period of time until, you hang out with us, people say things like, I sneezed and my neck went into spasm. So it was one more bending, or I was tying my shoelaces and my back went into spasm. So it's one more bending, over a lifetime of bending. I'm going to show you guys how to strengthen your spine without doing a single exercise. How does that sound? Sound pretty good? Okay? And we're going to use micro breaks to recover throughout the day. Okay, so we already talked about that a little bit. All right. Quick anatomy lesson. You guys know this. Cervical is the neck, thoracic mid-back, lumbar, and the pelvis. Okay, what's important about this, we talked about, is the junctions. Okay, so the junction right here and here is where all the trouble happens, because we hinge there. 3 postural habits, okay? First one's neutral, and we're going to talk about what neutral means. So, if you guys slide to the edge of your chairs, okay, and you visualize a cable pulling your chest forward, okay? So what you guys just did at that moment is you activated your low back muscles. So the low back muscles only work when we're in an upright posture. Now take your hands and put them like this on your back, and what you'll feel is you should feel the muscles are erect on both sides of your spine. So you should feel like a muscle, and then a valley, and then a muscle. Okay, you should feel those contours. Now with your hands right there, go ahead and just slump forward. Okay, and what you'll feel is the bony parts, the spinuses stick out, and the muscles relax. You guys feel that? Okay, so now sit back upright. Now if you stay in that position long enough, your back muscles are going to get sore, because you're using your back muscles. Okay? So left unconscious, most people will turn those off. Go ahead and just slump back down. Now you get temporary relief of those muscles. And that's a really important thing to understand, because at this moment what's happening is pressure in the discs have gone up significantly, but your pain experience has gone down temporarily. Okay, so it creates a disconnect between what's really happening. Okay, so if you have tired, achy muscles, and you turn them off, you'll feel temporary relief from the tired, achy muscles, but now you put all the pressure on your discs. And that's what ends up causing people to have recurrent problems, because they're unconsciously bending forward because their back muscles are tired or deconditioned, or they're simply tired, because you've used them throughout the day. So that's where recovery really becomes important. Here's what I want you guys to do moving forward. As you're going about your day and you're thinking consciously, we're going to actually do a couple of things where we'll visualize lifting animals and doing some things where you're actually hinging at your hip joints. That keeps your spine neutral. If you guys do good body mechanics throughout the day, at the end of the day, your low back muscles should be sore. Okay, you should feel symmetrical discomfort here. Now, when you feel that, the first thing I want you to do is pat yourself on the back, okay, because you used good habits throughout the day and you're actually getting stronger. And then if you go home and rest, and the next morning you feel better, you'll know it was muscular. That makes sense? And it'll be symmetrical. It'll be on both sides, typically. If you get one-sided discomfort, there's something either amiss, something's out of alignment, or there's excess pressure on a nerve somewhere, or a joint. Something's out of alignment, most likely. Okay? So that's neutral and strength. And we're going to get into a little more detail about that. Rest recovery we talked about. There's 2 types. There's passive and active. So if you guys now slide all the way back, and these chairs have nice lumbar support, so if you lean back against those, you just went into a rest position. You're not using your muscles to hold yourself upright. The chair is holding you. Does that make sense? So that's a passive rest mode. And that's why ergonomics is such a big thing in workplaces where people have to sit down a lot. Okay? The other form of rest is called an active rest, and I'll show you what that means. It's kind of a little bit of an oxymoron to call it active rest, but I'll show you what that means. And finally, degenerative. I put degenerative in red because that's what I need you to avoid. Now, come back to the front of the chair. Okay? Now, slump forward again. Okay? Regardless of how you're feeling, goes in slump position like that. Okay? Regardless of how you're feeling, you've just increased the disc pressure, and therefore you're accelerating the degenerative process. Okay? So it increases the rate of breakdown. So we call that a degenerative posture. Okay? I stopped calling it poor posture because, everybody's like, poor posture, whatever. So by calling it a degenerative posture, I thought maybe that'll have a little more impact, because that's what it's doing. It's breaking down those discs. Okay, so you need to be aware of it, because it really starts with awareness. Okay, I love my intervertebral discs. Okay, and by the time we're done here, I want you to really value the hardware in your spine, and the most valuable hardware are those discs, because the discs have to bear your body weight your entire life. Okay, they're the cushions between the vertebrae. They're what inevitably gets injured from forward bending. So what this is showing is that there's 2 parts to the disc. There's a liquid in the center called the nucleus, and that nucleus, think of it like a jelly donut, okay? Actually, it's much, much stronger than a jelly donut, but the jelly donut really makes the analogy. If you take a jelly donut, you squeeze one end, what's going to happen to the jelly? It's going to go the opposite way, okay? So what do we do as human beings? We bend which direction? Forward or back, mostly? Forward. So when we bend forward, we're going to squeeze the front, what's going to happen to the jelly? It's going to out the back, okay? So disc protrusions, 99% of the time, are posterior. Okay, they go back, because human beings go forward, okay? So it's really that, now you guys know more than 99% of the population. You know, I had a lot of neck problems and I couldn't get in that area, and our spines and our torsos are round, so contoured surface fits the body better. And it reduces the pain experience. That's the problem with straight edge foam rollers. You guys are really interested. I've gotten way too interested in this, obviously. But a single point contact puts a lot of pressure on a single point, whereas a concave surface distributes that pain experience. So you can really slow down and get a deep tissue experience with a lot less pain. So
Does it come with a video?
There's videos for it too, and I'm happy to share that here in a bit. But so you can basically self-massage your entire body in about 30 seconds per area. So I'll hit whatever area is tight. I'll always do my spine, and so to get that mobility on a daily basis, I tell my patients, go home and floss your body. Literally, I want them to have that same consciousness as taking care of our teeth, because who brushed their teeth today, right? Why? We were trained, right? It makes sense. We don't think about the spine that way. So if you thought about the spine that way and did recovery stuff, you'd have a lot less issues. I'm certain of that. Okay, so here's back bending. Go ahead and stand up for the low back. So throughout your day, you know, okay, so in fact, do this prevented throughout your day, but especially if you've just handled a larger or any weight patient that you've had to, you know, hold their weight and then set them down. First thing I want you to do is to think about those discs, right? Forward bending increases pressure, let's push them back in. So what I like doing is I like hooking my thumbs as close as you can get to the upper low back. So right at that junction, you get your thumbs back there. And what I do is I simply think about a cable pulling my chest right past my nose, and it's kind of it's not bending back as much as it is up. And then I'll just shift my thumbs one level lower, and I'll just keep doing that all the way down. And what I'm envisioning is I'm pushing those discs in. Now, you guys will probably feel some discomfort if you're doing that, right? You guys feel a little bit of discomfort? Okay, so that's the facet joints getting compressed. So just go to your tolerance, okay? So don't exaggerate it. It's just it's a tiny shift, okay? It's a tiny shift. Always go to your comfort level. Not all discomfort is bad, you know? I mean, there's some pain that's actually really good. And so it's just being aware of what's happening. The risk is very low. You'll get temporary discomfort with tremendous benefit because you push those discs back in.
Are you supposed to hold your abdominal muscles
No,
tight? Just let it
no.
relax.
Yeah, totally let it relax. This is not a strengthening exercise.
Okay.
You're just simply decompressing those discs. You're just pushing those discs back in. You know, that's how I'm envisioning it. Okay. Same thing for the neck. So this is a real simple one. So just like for the same exact reason, we put a towel around the neck. Okay, if you don't have a towel, you don't need a towel, but it works great with a towel. So just keep the towel around. The first thing I do is, you know, towel around the neck, and you guys envision this with me. So you're holding the towel, you're sitting tall, and envision your head is being pulled up and back. Okay, and then from there you can do a gentle extension. Okay, one of the things I tell patients is kiss the sky once a day. All right, just by simply like doing that, because these muscles in the front get shortened from looking down all the time. Okay, so that's what then, and so does the chest muscles, which is the next thing we're going to look at. So these are all. Here's another stretch for the traps. Okay, and I put this on here because the traps also have to sustain our head weight. So the way I do it is arm behind the back, and then really gentle. Try this; it feels really good. Just hand behind the back, and you take your hand just gently. Okay, pull it away, and you should feel that stretching on the side. Or, you know, yeah, there you go, exactly. Okay, you guys should feel that. And if you just vary your eye position, if you look down, you'll get different aspects. If you look up, you'll get different parts of it. You can also change your hand position, okay, to get different, yeah, grab the front side of your hand, the back side, exactly. Nice and gentle, always to your comfort level. Shoulder shrugs, real simple way to bring blood flow to that area, up and back. And it also reminds you of better posture. So these are all micro breaks. Okay, so I don't want you to think. You don't have to do all of them every single day, but if you get in the habit of the back bends, okay, extension in the low back, extension in the neck, shoulder shrugs. The next one is chest stretches, should be, yep. So you step through a doorway. Yeah, these arrows got misplaced. The stretch is not happening here though. So apologies for that. But I shrunk them down, they were too big. So basically I'm stepping through a doorway. Okay, this is back when I didn't have gray hair. So you're stepping through the doorway and stretching your chest out. Okay, because these muscles shorten, and as a result of doing everything in front of us, that pulls our center of gravity forward. So that's what we're really talking about, is having this recovery consciousness, and by doing a couple things throughout the day, doesn't matter if you're at work or not, you're going to be recovering much more easily. Here's a lat stretch, arm over, tilt to the side. The lats attach in the front. They're part of your pusher muscles. They also shorten. Okay. Here's a series of lower extremity stretches. I did all of these on the back because they are the lowest risk way of doing it. Obviously, you can't do these here. There are other ways to stretch these that I didn't put on here. But come stand up. Let's try it. Like the hamstrings. Okay. Hamstrings real simple. Just put your one leg out. Okay, and then just stick your butt back. Okay, chest tall, chest really tall. So all of you that immediately did this, that's your habit. Okay, so chest tall, perfect form, butt back. You feel that? You guys feel that? Yeah. Great. Okay, so you didn't have to bend over. Notice? So all that stuff they taught us in junior high, is wrong. You know, and it builds bad habits, and they. Anyway, I saw this kid who was going out surfing the other day, and he's trying to be good, and he crosses the leg over. I know exactly what he's going to do, because that's what we all did. Cross the leg over, flop right over. So I want to go in, hey, there's this question. Okay. So then this is the hip flexors. Okay, hip flexors in the front. They are stretched in this lunging position. You don't have to sit down. You can actually just be standing to get that stretch. Your pelvis has to be pointing straight ahead to get the benefit, so you're stretching this in the front. Hip flexors shorten from sitting, as do the hamstrings, because the hips and knees are bent for a long period of time. Imagine if you walked around with your elbow bent all day long, your bicep muscle would literally shorten, and you couldn't straighten your elbow out. That tissue gets shortened. So that's what happens to the hip flexors and the hamstrings. Hip flexors are particularly, the deeper hip flexors, the psoas muscle, are particularly have an effect on the spine, because when they shorten, they do this. They pull the pelvis forward. So when they pull the pelvis forward, it's going to jam those joints. Remember, we talked about the facet joints in the back getting jammed? So if your facet joints are jammed in the back, what are you going to feel like doing to make them feel better? Okay, so now you can see how hip flexor tightness can eventually lead to disc problems. Because you're compensating to compress joints in the back, because these are all tight. So you don't have to know the exact science behind it, but trust me, I tell you, these things done. I always take a shotgun approach. What does that mean? I do it all, and then I kind of figure it out from there. I kind of go, okay, let me just see. Oh, I feel a little tightness. And then I'll switch on. It's like, oh gosh, that's really tight. Then I kind of think about, well, why is one side tighter? And you can usually find the answer in a habit you have, or some past injury or something. It's not really that important. It's just that you discovered, hey, this side's tighter. Spend more time on that. These are the groin stretches. Do these on the back because they're safe on the back, but alternately you can just lean side to side. That feels really good to me, because that improves the hip mobility, okay, and your ability to bend. Okay, walking is active rest. It's another form of walk. You guys doing that all day long, which is fantastic. Because walking, and when you guys are walking down the hall, put your hands on your back and just walk. And what you'll feel is you'll feel one muscle turn on, one turn off, one turn on, one turn off, one turn on, one turn off. So when you're walking, you're actually resting your back 50% of the time. Whereas when you're seated, even using good posture, you're using it statically all the time. And that's why people end up with issues that are sitting a lot. So what's your habit? That's what I want you to take away from today. Increased disc pressure is the big picture I want you guys to understand. And then start asking yourself the simple question, what's this doing to my spine? For the next 24, 48 hours, just kind of really think about that. Think about, what is this activity doing to my spine? The longer you're in that position, the harder it is on your spine. Okay, because it's just multiplied over time. I love home care products. That's why I got into this business. The IntelliRolls that anatomic side foam roll we're talking about. But we use home traction units. If you have neck issues, you can get a Bodyline neck decompressor. It's fantastic. It's inexpensive. I'm big on low tech home stuff. Because that's the stuff all that we use. Swiss balls are great for stretching. They're great for doing core strengthening, bridges, things like that. Sometimes at home, when we're watching TV, we have a Swiss ball, and we have the foam roll, and we have bands, just kind of all right there, and we spend that time in recovery mode. So that's where I encourage you to keep it. Keep it where it's in sight and you can use it. These pillows are called a mid-core. With the exception of the IntelliRoll, I have no affiliation with any of these, okay, just to be clear. But we use these, I've been recommending these pages for a long time. This really helps to restore the curve in your neck. So at night, this is what I'm using for 15 years. When I lay on my back, it introduces the curve back into your neck. Because we lose that throughout the day, now gravity's doing the work for you. And you stick a pillow on your knees and your spine stays relatively neutral. It's a great way to recover. Bands is a great way to strengthen your neck. You can see that. We also talked about looping it around your legs, using it to strengthen the muscles between your shoulder blades. If you do nothing at all, do those 3 things, neck retractions, the band, get another one, put a loop it around your legs, and just do side steps, okay? Okay, and grab the band and just pull them. Just do those 3 exercises, your spine will be so much stronger, okay? But then you gotta then follow it up with some recovery stuff. Inversion chairs for people who do have chronic issues, we do recommend that. It's decompression. They did a study and they found that of all mammal vertebrates, bats were the only ones that didn't have arthritis at advanced age. And they think it's because they hang upside down. They're decompressing their spine when they sleep.
How long do you do the upside down thing?
You know, we put them in the clinical setting, we don't leave them on there for more than 15 minutes. I think 15 minutes is plenty, because after that point, you actually are putting stress on the ligaments. So, you know, less is more often, you know, and we always take the strategy of wait and evaluate, okay? Even when you're returning to activity, you're trying something new, you know, when adrenaline is going, you guys know what the purpose of adrenaline is in the sympathetic nervous system is, right? I mean, it's there to shut off pain so you can run away from the animal. Oh, that's not a pun, that was not intended. You run away from danger, you're in that fight or flight, so the body will mask the pain. So less is more, I always wait and evaluate, and thank you for the opportunity, and what questions do you guys have of us? Of me? Chuck? Yes, sir?
Well, I'm in this setting to where, cause I work in administration, I'm sitting
Yes.
at the computer all the time. I mean, like, what can I do to kind of rest and kind of
Walk.
Because I noticed, like,
Yeah.
right here when you mentioned
Yeah,
that pain at times, it'll go down the leg type of deal.
yeah,
Or right here, the pressure,
yep,
like you mentioned, right here.
yeah. So all those things I talked about. So
So
sitting, remember, is high disc pressure. So 2 simple things you can do. 1, get up and walk around. Don't stay seated for more than an hour max. You know. There's the consciousness that may reduce productivity when in fact it doesn't. It increases productivity. Because you know there's only a certain amount of concentration we can apply to a static situation. You know, you put me in front of people and you're having a conversation with a person or you're interacting with an animal, time can fly by, right? But it's different when that interaction is with a computer. So take breaks. That's number 1. Get up, walk around. 2, do those things I showed you. Shoulder shrugs. Okay. Keep a towel around. Do neck extensions, kiss the sky. Okay. Go step through a doorway. I love it. Nice job. Thank you. Do shoulder shrugs. Remember, sitting shortens your hip flexors. Shortens your hamstrings. So you need to stretch your hip flexors. Get up and stretch them out. Okay. That'll make your pelvis go into a more neutral position. Stand up and just stick your butt out, stretch your hamstrings. Okay? Yeah, all these things apply to everybody. Some apply more to some than others. You'll know in the practice of trying them. You'll say, oh gosh, I didn't realize, wow. If you guys start stretching your upper traps, and if you guys right now are having more discomfort on one side, it's probably because you're leaning away from that side. So if you're right-handed and you're always leaning to the right, the left trap is going to work harder. Okay? Now the pain is going to be here, and you're going to want to stretch that, but in reality, which tissue is shortened? This side. And so when you go to stretch, you might find, holy smokes, I'm so much tighter on this side I didn't have any pain on. So don't necessarily just follow the pain. Do it on both sides, and then you'll know. You can self-diagnose, if you will, on a small level, hey, this side's tight.
We're gonna get headsets for anybody using phones, and I mean we've done in the past and people just don't use them. They don't want to use them, but
Yeah.
they're important, correct?
Very important. Very, very important. Everybody in our facility has them, and part of that may be just the ones that are more cumbersome than others. So that's more of a practical issue. But 100%, no question. I don't think anybody in this business would argue against it, because you're just not doing that kind of business. Yes.
I was wondering, I'm on my feet all day, and I had surgery like on my Achilles, so I was wondering like if you know any.
Did you tear your Achilles?
I tore it, yeah.
Me too.
So I was just wondering if you knew any good stretches to do, because like by the end of the day, like my ankle is like swole, and
Yeah, so you're getting a dependent edema. I don't know if there's a picture of it. You don't have to get my foam roll, but I'm a big believer in self-massage. So that's what I would do. Let me see if I can, instead of, you can stretch certainly, you know, it's toes up against something and then leaning forward on to stretch it. The problem with stretching tissue, and this is not, again, my opinion, but a lot of studies are finding that stretching inhibits muscle activity. So a lot of studies are coming out about, I don't know if there's a picture of it here. No, there isn't. Okay. I was going to see if there's a picture. But basically, you get a foam roll, sit on your butt, put your leg up on the foam roll, and then with your hands behind you, do small little motions. Okay? With your toe tilted in, tilted out, and just self-massage that area. I have the same exact issue.
Did you have surgery on it?
Yeah, I had a complete rupture. 9-month recovery. That's tough, isn't it?
Yeah.
That gave me a lot of appreciation for patient care, boy. That was, oh man, I gained tremendous appreciation for what it takes
And I
to.
was in my head of heel,
Yeah.
and there and reattached, and I feel like I'll never be normal again.
Yeah.
And it took me a year to recover from the first one.
Yeah, and in reality, you'll never be totally the same again, but none of us are the same from one day to the other.
True.
And so what you're trying to do there, hey, I used to use this other slide, which is a great slide, and what it showed is the damage and recovery, and it showed it on a scale. So I want you guys, I need to put that back in here. So when you have this scale and you think about the daily cumulative effect of whatever it is that we do and try to balance it with some amount of recovery, because otherwise the only recovery we really do is the sleep we get. And if you guys are like me, you know, you get 6 hours of sleep, it's usually not enough. You know? Is that a lot?
For me.
For me, yeah. For you? Yeah, I'm very happy when I get 6. But yeah, I mean, recovery is a consciousness and a habit, okay? Good body mechanics is an awareness and a habit, okay? So I want you guys to ask yourself, what is this doing to my spine? And just take inventory of the things in your life that are putting your posture, your body into forward position, okay? And ask yourself, how can I do this differently? Okay, everything from brushing your teeth to putting on your socks. You know, if you lean up against something and bring it to you and practice that, you'll get stronger in your leg muscles. Or sit and then cross the leg over instead of sitting and bending over to do it. One of the things we do to patients, we put a couple strips of tape on their back, and every time they go to bend, they feel it remind them, and it's a great training tool. So if you guys all want to volunteer one day, I'm going to come here and tape all you guys.
Are you able to kneel at all?
No.
That's what it's going
For what reason? What's
The
too high.
bathtub would be too high.
So if you were to elevate, have some sort of a foam pad that could be elevated enough that would lift you, let's say, 8 to 12 inches upward, where you would kneel in a position like this, would you be able to?
Probably.
Yeah, or like a wider platform, like a step, you know, like a Reebok step, you know, that's wide,
Right.
something like that.